I want you to try and imagine something for a second. Try to imagine keeping a tiny, incredibly delicate lineage of an animal alive for over 2,000 years.
Right, which is a massive amount of time.
Exactly. I mean, we were talking about a timeline that stretches all the way back to before the Roman Empire even existed.
Yeah.
And the real kicker here is the mechanism of their survival.
Yeah.
Because you have to ask yourself, how does a specific breed of dog survive that long without being, a rugged outdoor working dog?
Right, they don't have that fierce, independent survival instinct.
No, not at all. They don't hunt. They certainly don't pull sleds in the freezing cold. They don't herd to eat. It survives through one incredibly specific, unbroken chain of events, which is just being meticulously, consistently cared for by human beings.
Century after century.
Exactly.
Yeah,
Generation after generation.
It really is a profound testament to the human-animal bond when you look at it through that specific historical lens. Because the physical evolution of a breed like the Maltese, it didn't happen in the wild. It happened in laps, it happened in living rooms, and that completely reframes how we have to view their physical needs today. You aren't just owning a pet, You are literally participating in an ongoing 2 millennia-old project of selective miniaturization.
Okay, let's unpack this because the mission of this deep dive is absolutely not to cause anxiety.
Definitely not.
We're taking a really comprehensive look at the specific medical and physical health profile of the Maltese dog based on our source material today. But we are not here to make a living with one feel like you're tiptoeing through a medical minefield.
No, the goal is empowerment.
Exactly. Because this breed relies entirely on human observation, recognizing small physical changes early is a protective measure. It is not a reason to panic.
Right, and the tone we really need to establish here is one of calm, analytical observation. We are going to trace the biological realities of this dog from the very tip of its nose right down into its genetics. And by understanding the mechanics of how this tiny body actually functions, you are simply continuing that exact same tradition of attentive care that, like you said, kept them alive through the fall of Rome in the Middle Ages.
So, since this breed's survival required incredibly close, face-to-face human interaction, the most logical place to start mapping their health is right where you interact with them the most, which is the mouth.
Yes, the dental health.
Because there is a massive, incredibly common misconception out there that because a dog is small, its dental needs are somehow less significant or less rugged than a big working dog like a German Shepherd.
Yeah, and the reality is actually the exact opposite.
Oh, wow.
Yeah. Small breeds, and the Maltese in particular, they need far more dedicated dental attention than larger breeds. And it all comes down to the unintended consequences of breeding for a smaller skull.
Right, the miniaturization.
Exactly.
Yeah.
When humans selectively bred these dogs down to a toy size, the jaw bones shrank significantly. But here's the problem. The physical teeth did not shrink at the exact same proportional rate.
So it's a structural issue. Think of the Maltese jaw, like a tiny studio apartment where someone tried to cram in a full-size living room set. There's no space between the furniture, making it impossible to sweep the floors. That's why plaque builds up so fast.
That is a perfect analogy. Because that studio apartment is so cramped, the normal self-cleaning mechanisms of the mouth, like saliva flow and just the mechanical scraping of chewing food, they totally fail.
Right.
That crowding creates countless microscopic crevices where plaque, which is, just a sticky film of bacteria, it becomes permanently trapped.
Then it hardens, right?
Yeah, within days. That plaque mineralizes into hardened tartar. And if that's ignored, periodontal disease sets in. The dog's own immune system basically starts attacking the inflamed gums, trying to get rid of the bacteria, which eventually just destroys the bone holding the teeth in place.
So it leads to tooth loss and this chronic, silent pain. But the mouth is also a gateway to the rest of the body, right? I mean, the real danger isn't just a tooth falling out. It's that the network of blood vessels in the gums is highly porous.
Spot on. The bacteria from those infected gums leak directly into the bloodstream every single time the dog chews.
Oh, man.
Yeah, that bacteria circulates and eventually filters through vital internal organs, primarily the heart valves and the kidneys, causing systemic microdamage over time. So, brushing a Maltese's teeth isn't some cosmetic luxury to make their breath smell better. It is foundational health care. You are protecting their internal organs.
Which means we really need to rely heavily on our senses to catch it early. Like, persistent bad breath is the most glaring early indicator.
Absolutely.
People love to joke about dog breath, but healthy dog breath should never clear a room or smell like decay.
No, it shouldn't.
And you also have to watch for behavioral changes because a dog won't usually cry out when his gums hurt. Instead, you'll see like a sudden reluctance to chew hard kibble, or they might just stop picking up their favorite toy.
And the anatomical compromises of breeding for a miniaturized skull, they don't stop at the jawline either. That same physical compression cascades right down the dog's throat and into its structural framework.
Right, so let's follow that cascade down to the respiratory system. In small and toy breeds, you frequently encounter a mechanical issue called tracheal collapse.
Yes, very common.
Because the windpipe isn't just a floppy tube, right? It's held open by small, C-shaped rings of cartilage. I like to think of it like the hard plastic ridges on a vacuum cleaner hose that keep the hose from sucking shut.
That's exactly how it works.
But in a Maltese, those cartilage rings can structurally weaken and lose their rigidity.
Yeah, and when those rings lose their stiffness, the negative pressure of breathing in actually causes the airway to partially flatten out.
It just collapses on itself.
Exactly. And the sound of this happening is highly distinctive. It's a sharp, dry, goose honk cough.
A goose honk.
Yeah. It doesn't sound like a wet chest cough. It sounds exactly like a goose honking in your living room. And because it's a mechanical collapse, it is highly reactive to environmental triggers.
So what sets it off?
Well, it flares up when the dog is overly excited and breathing heavily, or when the weather gets warm and they pant, or, crucially, when physical pressure is applied to the neck.
Which is the exact biological reason why using a harness instead of a traditional neck collar for leash walking is just a non-negotiable preventive measure, right?
Absolutely
You
non-negotiable.
just cannot put pulling pressure on a windpipe that is already predisposed to flattening. But that miniaturization trade-off, it extends even further down the body, right into the mechanics of their hind legs.
We see this heavily in a condition called luxating patella.
Okay.
The patella is just the kneecap. So in a structurally sound canine knee, the kneecap glides up and down inside a deep V-shaped groove in the femur bone. But in many toy breeds, that bony groove is simply too shallow.
Okay, so it doesn't stay on track.
Right. Because the groove lacks depth, the kneecap literally pops out of place and slides to the inside of the leg.
And the symptoms of this are bizarrely intermittent from what I understand. A dog might be running perfectly fine in the yard, suddenly skip or hop on one back leg for 3 or 4 steps, and then, as the kneecap naturally snaps back into that shallow groove, the dog just resumes walking completely normally.
Yeah, that's exactly what it looks like.
Wait, I have to push back here, because human nature plays a huge role in how we observe our dogs.
Oh, for sure.
If a dog is only honking when the doorbell rings and it gets super excited, and the rest of the day it's perfectly fine, or if it just does a little quirky skip in the yard once a week but isn't actively limping or crying in pain, aren't we over-medicalizing a normal breed quirk? Why put a dog through expensive vet tests and treatments for a happy cough or an occasional skip in their step?
This raises an important question about how we fundamentally view disease progression in orthopedics and respiratory health. Because it is never just a quirk. It is a mechanical failure that exists on a timeline. A luxating patella isn't just a bone popping out. Every single time that kneecap slides out of its groove, it violently scrapes away the protective cartilage on the femur.
Oh, I see.
If you dismiss the occasional skip because the dog isn't crying, you are allowing the joint to slowly grind itself down until severe osteoarthritis sets in.
So by the time they are constantly limping, the cartilage is already gone.
Precisely. The damage is done. And the same applies to the trachea. Every time the windpipe collapses and causes that honking cough, it creates inflammation.
Which makes it worse.
Right. Chronic inflammation further weakens the Romeo cartilage. The window for conservative management is early on. If a vet establishes an early baseline for the knees, intervention might just mean strict weight control so the tiny joints aren't carrying unnecessary mass, or maybe just adding joint supplements.
But if you wait,
If you wait until the kneecap is permanently dislocated or the trachea is severely chronically flattened, you are no longer looking at management. You are looking at highly complex, invasive surgical reconstructions.
wow. You have to intervene when it's a whisper, not when it's a shout.
Exactly.
Let's trace our way back up the dog's body, from the structural joints and throat, back to the front-facing results of their anatomy, the eyes. Because for the Maltese, the eyes are really the center of their emotional expression. But they come with a mix of purely cosmetic oddities and some incredibly serious health indicators that you really have to learn to differentiate.
Tear staining is invariably the first thing people notice.
Oh, yeah.
It's incredibly stark on a pure white coat. You get these heavy reddish-brown streaks running down the face from the inside corners of the eyes.
Here's where it gets really interesting. That reddish-brown stain isn't just dirt from the yard, and it isn't a bacterial infection. It's driven by a pigment naturally found in dog tears, saliva, and urine called porphyrin. Porphyrins are iron-containing molecules. When those iron-heavy tears sit on the white fur and are exposed to sunlight and oxygen, they literally oxidize. It is quite literally a chemical rusting process happening on the dog's face.
It is a brilliant bit of biochemistry to observe, really.
Yeah.
And for the vast majority of Maltese dogs, it is entirely benign.
Okay, that's good to know.
Yeah, the breed's compressed facial structure, with those slightly protruding eyes and shallow eye sockets, it simply predisposes them to excessive tearing. The tears spill over the lids rather than draining down the tear ducts into the nose.
Right.
But as an owner, you have to know exactly when that tearing crosses the line from a chemical reaction on the fur into a glaring medical red flag.
Because it's so easy to just wipe their face and assume everything is fine.
Yeah.
So what are the mechanical signs that the tear ducts or the eye itself are actually compromised?
You look for the break in symmetry and sudden shifts.
Okay, symmetry.
If a dog has had mild symmetrical tears staining its whole life, that's their anatomical baseline. But if the tearing suddenly increases dramatically in volume, or if you notice it is now only heavily affecting one eye when it used to be both, that indicates an acute problem.
That makes sense.
Furthermore, if the tearing is accompanied by the dog holding the eye half shut, or rubbing their face on the carpet, or if the discharge turns thick and yellow, it is no longer porphyrin oxidation.
It's an infection.
It's likely a blocked tear duct, a painful corneal ulcer, or a severe environmental allergy.
Okay, so beyond just tearing, we also have to look deeper inside the eye itself, because there are genetic mechanisms at play that slowly alter how the dog perceives the world.
Two specific conditions dominate here. The first is progressive retinal atrophy, or PRA.
PRA.
This is an inherited genetic condition where the photoreceptor cells at the very back of the eye, the retina, gradually deteriorate. And that inevitably leads to complete blindness.
And the biological mechanism of how PRA starts is incredibly sneaky.
It really is.
Because the retina relies on two types of cells,
Right.
rods and cones. Rod cells are responsible for low-light vision and tracking movement, while cone cells handle bright light and color detail. In PRA, the rod cells typically degrade long before the cone cells do.
Yes.
So the dog can see perfectly fine on a sunny walk in the park. The very first symptom owners notice isn't bumping into walls, it's the dog suddenly hesitating at the top of a dark staircase at night. Or refusing to go into the unlit backyard because their night vision has completely vanished while their day vision remains intact.
Yeah, owners often just think the dog is being stubborn, but they literally can't see in the dark anymore. The other prevalent condition is cataracts.
Right.
Unlike PRA, which attacks the back of the eye, cataracts attack the lens at the front. The proteins that make up the lens structure begin to denature, break down, and clump together.
Like a cloudy film.
Exactly. It physically blocks light from passing through, appearing as a dense, cloudy, bluish-gray haze forming directly over the pupil. While cataracts can be surgically managed to restore vision, any sudden cloudiness warrants an immediate veterinary workup to rule out underlying triggers like uncontrolled diabetes, which can cause cataracts to form essentially overnight.
Wow, overnight. So up to this
Yeah.
point, we've been dealing with things that are highly visible, or at least highly observable, to an attentive owner.
Right.
You can see the oxidized tear stains, you can hear the honking cough, you can watch them hesitate in the dark. But the next category of health risks happens completely out of sight. These are the threats that either hide silently for years, masking their progression, or strike with zero warning whatsoever. Let's dive into the silent and the sudden, starting with the heart.
In toy breeds, the paramount cardiac concern is mitral valve disease. The heart is basically a series of muscular pumps and doorways. The mitral valve is the crucial doorway separating the left atrium from the left ventricle. As these dogs enter their senior years, that specific valve often begins to degenerate and lose its structural integrity.
Right, so if we think of the heart like a mechanical water pump, the mitral valve is supposed to be a perfectly tight rubber seal. It opens to let the blood pump forward and snaps shut so the blood doesn't flow backward.
Yes.
But with mitral valve disease, that seal starts to warp and fail. When the heart pumps, instead of all the blood rushing forward into the body, A small amount physically leaks backward into the upper chamber.
And the sound of that backward turbulent blood flow is exactly what a veterinarian is hearing when they detect a heart murmur through a stethoscope.
Right, the murmur.
And the insidious nature of this disease is its silence. Because the dog's body is incredibly adept at compensating for that tiny backward leak early on, a dog with early-stage mitral valve disease will appear completely fine.
They act totally normal.
They will run, play, and eat with zero outward signs of illness.
And if you wait until you actually see the physical symptoms of heart failure, which usually manifest as a soft, lingering cough at night because fluid is backing up into the lungs, or extreme lethargy after a short walk, the disease has already progressed to a critical, life-limiting stage, right?
Sadly, yes.
The early damage is entirely invisible. Now, on the complete opposite end of the spectrum from a slow, silent disease is a neurological condition called white shaker dog syndrome.
Yeah, the clinical term for this is idiopathic cereballitis. Idiopathic simply means the medical community hasn't pinpointed the exact underlying trigger, though it is widely believed to be an autoimmune response.
Okay.
It involves the acute inflammation of the cerebellum, which is the specific region at the back of the brain responsible for coordinating fine motor movements and balance. And it is overwhelmingly seen in small, white-coated breeds.
And the onset is the definition of sudden.
Yes, very sudden.
A perfectly healthy, young to middle-aged dog will abruptly develop full-body tremors. They will start shaking violently, and it won't be linked to a drop in temperature or a fear response like a loud thunderstorm. Their brain's motor control center is just misfiring.
And witnessing a neurological event like that in your living room is deeply traumatic for an owner.
I can imagine.
The immediate assumption is that the dog has a fatal brain tumor or is experiencing a catastrophic failure. But the biological reality of idiopathic cereballitis is that despite how terrifying the physical tremors are to watch, it is highly treatable.
Oh, that's such a relief.
Yeah, veterinary intervention with immunosuppressive drugs, usually corticosteroids, rapidly reduces the inflammation in the cerebellum. These dogs routinely see massive, rapid improvement. It is a sudden, frightening storm, but it passes with the right medication.
There's one more sudden condition we really have to cover, and this one is highly specific to the physics and biology of tiny puppies, and that's hypoglycemia, or severe crashing low blood sugar.
A toy breed puppy is basically an exercise in extreme metabolic demands. They possess an incredibly fast metabolism just to keep their tiny internal organs functioning and to maintain their body heat.
Because they're just so small.
Right. The problem is, their livers are so small they cannot store adequate reserves of glycogen, the stored form of glucose, and they have virtually no body fat to burn as backup fuel.
So it's a physiological tightrope. If a tiny Maltese puppy misses even a single meal, or if they undergo a period of high environmental stress, like the physical and emotional transition of moving away from their mother to a new home, their body quickly burns through whatever glucose is in their blood.
Yes.
Because there are no reserves in the liver to draw from, their blood sugar plummets dangerously fast. The brain is starved of energy, leading to lethargy, severe shivering, disorientation, and eventually full-blown hypoglycemic seizures.
What's fascinating here is the mechanics of the emergency response. If you have a toy puppy exhibiting these signs, you do not just wrap them in a blanket and wait in the passenger seat while someone drives to the animal hospital.
Yeah.
No. The immediate triage is to take a highly concentrated simple sugar, like corn syrup or even honey, and literally rub it directly onto the puppy's pale gums.
Oh,
Yeah.
because the mucous membranes in the mouth absorb it immediately, right?
Exactly. The sugar molecules bypass the digestive tract completely and absorb straight through the gums directly into the bloodstream, reaching the brain in seconds.
That is incredible.
That simple, immediate spike in blood glucose can stabilize the puppy's neurological function enough to keep them alive during the transport to the vet. It is a fundamental life-saving mechanism every toy breed owner should understand.
Okay, we have covered an immense amount of ground. We've mapped out the crowded biomechanics of the jaw, the structural limits of collapsing windpipes and shallow knee grooves. We've looked at the chemistry of tear stains, the genetic cellular breakdown in the eyes, the silent fluid dynamics of a failing heart valve, the misfiring of the cerebellum, and the metabolic tightrope of a tiny puppy. If you are listening to this, you might be feeling overwhelmed. How does a single owner manage this blueprint of potential failures without descending into constant panic?
Well, if we connect this to the bigger picture, it all comes down to understanding the intersection of genetics and environment. That is the true blueprint of care.
Okay.
The management begins before the dog takes its first breath. Ethical breeders are actively engaged in risk mitigation. They perform advanced genetic DNA screenings and physical orthopedic evaluations on the parent dogs.
Right.
They check the retinas for PRA markers. They manually grade the depth of the knee grooves. And they listen for those silent cardiac murmurs. They intentionally stack the genetic deck to remove as many of these mechanical failures from the bloodline as possible.
But once that puppy is sitting on your rug, the baton passes entirely to you.
Yeah.
The absolute most critical shift in mindset is abandoning the idea that you only take your dog to the vet when they are visibly sick or limping.
Yes. We've established why reactive medicine fails this breed. Annual exams and strictly biannual exams for seniors are the only mechanical way to intercept these issues.
Because they hide it so well.
Right. A stethoscope is the only tool that will catch the turbulent backward blood flow of a failing mitral valve, while medication can still massively reduce the heart's workload. Routine palpation of the legs is the only way to spot a slightly shallow kneecap groove before years of friction grind the cartilage away entirely.
So what does this all mean? We can look at this medical profile not as a terrifying prophecy of things to come, but as an incredibly detailed map. You cannot change the genetic code your dog was born with.
No, you can't.
But through the environment, you construct the diligence of the daily dental brushing to block bacteria, the use of a harness to protect the cartilage in the throat, the strict weight management to save the knee joints. You heavily dictate how those genetics express themselves.
It is the ultimate real-world application of epigenetics and environmental management. You are manipulating the dog's daily reality to ensure the genetic risks never have the opportunity to become acute emergencies.
Right. When you are standing in your bathroom late at night, carefully brushing your tiny dog's crowded teeth, or when you are paying for an annual wellness exam for a dog that seems perfectly healthy, you aren't just doing chores. You are actively participating in the exact same 2,000-year-old mechanism of human intervention that kept this delicate lineage from going extinct. You are the reason they survive.
And the incredible payoff of that meticulous intervention is longevity. While the anatomical challenges we've mapped out today are real, the statistical reality is that Maltese dogs are remarkably robust when properly managed.
They really are.
They routinely live vibrant, active lives well into their mid to late teens. They achieve that staggering lifespan precisely because of the proactive care we've detailed. Having thoroughly mapped out the mechanics of their physical health, we are perfectly positioned to explore the next frontier, which is the complexities of their mind and their profound emotional intelligence.
Which brings me to a final lingering thought I want to leave you with before our next deep dive. We know from the biology we just discussed that this breed is incredibly sensitive to physical stress. I mean, a simple change in environment can cause a tiny puppy's blood sugar to completely crash.
Yeah.
But if their bodies are that reactive, how deeply does human psychological stress impact them? If you, armed with this comprehensive medical map, become constantly hypervigilant if your heart rate spikes every time the dog clears its throat, or you tense up with anxiety every time they jump off the couch, could you inadvertently be transferring your own chronic stress to an animal whose breed has spent 2 millennia learning to perfectly mirror human emotions?
That's a huge thing to consider.
It's a fascinating tightrope to walk. How do you balance strict, unyielding medical vigilance with being the calm, deeply stable companion your dog actually needs you to be? Something to ponder.